one of the authors of a second edition of Comparative Health Systems. Some of you probably had seen the first edition. We now have a second edition, it's this one, and I've worked with Carlene Stoskopf and Lei Yu Shi. What this book does is it describes the health system of 25 different countries, and we compare them across the dimensions of cost, quality, access, and innovation. Last edition, we only looked at cost, quality, and access, and this time we added innovation as a key element of sustainability. In addition to comparing the different countries, the 25 or so countries, we discuss social determinants of health. We talk about some global disease challenges that all of these countries are facing. We compare the countries across economic dimensions. Each country that we profile in this book, we actually provide a historical background, political context, cultural description. So when a student is using this book, they read about the healthcare system, but they also understand the context in which this system is functioning. We have a couple of new areas that we didn't have in the first edition. For example, we have an entire chapter on health systems in crisis. So we look at what happens to a health system during natural disaster or an overload from epidemic or perhaps conflict. Many different situations that can put a health system in crisis, and then the chapter addresses how that health system responds and how this health system can stand back up to be sustainable. We have another chapter on economics and policy and how that affects a health system and address some best practices. And then lastly, we discuss non-governmental organizations, NGOs, and intergovernmental organizations, IGOs, like World Health Organization. NGO would be, say, Doctors Without Borders. And we talk about how those augment a health system. And we really see this in developing countries where the health systems might be, say, under-resourced, or for political reasons they're somewhat suppressed, and the NGOs and the IGOs can come in and augment the system and make it stronger, more robust, more responsive, more capable. So we cover all of that, and then lastly we have a chapter on future trends, future developments. We look at global mental health, global aging, global economics, and so forth, and address how that has an impact or affects health systems. So anyway, it's a new edition. A lot of valuable resources in the book. It's comprehensive. I would say on this topic, it's the best book available.